Well, hello, everyone, and welcome to our second In Conversation for TogetheRide. I'm Russell Roybal, Chief Advancement Officer at San Francisco AIDS Foundation, and I'm excited to welcome you to this conversation about HIV/AIDS research and its impact on the COVID-19 pandemic. But before we get started with our fabulous panelists, we first want to do a little bit of housekeeping items, just so that if you need closed captioning, in the bottom left-hand corner of your screen, there is a QR code you can scan. If you're watching from twitch.tv or Facebook Live and you have question or comments for our guests, please enter your comment or question there, and we will have a chance at the end of the show to ask our panelists all of your as many of your amazing questions as we can. So I'm excited to introduce our guests today and tell you a little bit about them, and then we'll get right into the questions. So everybody ready? Let's get started. Janessa Broussard, nurse practitioner, is Vice President of Medical Affairs at San Francisco AIDS Foundation, overseeing the provision of HIV prevention and PrEP, sexual health, HIV and hepatitis C care, services for transgender and non-binary clients, and clinical research. Janessa directs multi-site clinical services at SFAF with a nurse-led team that continues the legacy of nurses being at the forefront of HIV care. Since June of 2018, Janessa has served as president of the Association of Nurses in AIDS Care Golden Gate Chapter. Welcome, Janessa. I also want to introduce to you Dr. Robert Bolan, who's been the Chief Medical Officer at the Los Angeles LGBT Center since May of 1996 and was the Director of HIV Services in the Department of Family Medicine at the University of Southern California from 1995 to 2004. Prior to this, he was in private practice in San Francisco since the beginning of the HIV epidemic, and a fun fact, was the first chairman of the board of San Francisco AIDS Foundation from June 1983 to January 1986. So it's all in the family here today. So welcome, Dr. Bob. Welcome, Janessa. We're gonna go through some questions today. Again, if you have questions that come up during our conversation, please put them in the chat on Twitch or on Facebook Live. So let's get right to the questions. Let's start off by talking about where we have been and where we are right now in terms of COVID-19. California has been hit hard by the COVID-19 pandemic, and the governor just recently lifted the state's stay-at-home order. Janessa, can you give us an idea of the current state of the pandemic in the Bay Area?
Sure. So, San Francisco and the Bay Area was certainly fortunate early on in the pandemic, but we went through a couple of challenging months towards the end of the year. Thankfully, more recently, we're seeing positive indicators in most areas. We're finally seeing significant drops in the rates of new cases. Last week, we had a 26% drop in new cases, which is really great. Second week in a row that we've seen a real decrease. ICU and hospital capacity is increasing. And we are seeing, thankfully, some progress in the vaccine outreach as well. The focus is really on the communities that have been hardest hit by COVID, such as the Bayview, Mission neighborhoods in San Francisco, and East Oakland. So that has been a positive indicator. Unfortunately, we have seen our first cases of the UK and Brazil variant in the Bay Area. It's hard to really understand the extent because of the lack of genomic testing. But it really, we're really hoping that the vaccine distribution increases at a pace that will minimize the impact of these variants in San Francisco and the Bay Area.
Thank you, Janessa. And what about Dr. Bob?
So we're actually seeing similar decreases in Los Angeles that were just mentioned in San Francisco. I just checked our LA County dashboard this morning before the call, and the 7-day average number of daily deaths are down from 200 a day down to 155, which is obviously still way too many, but it's moving in the right direction. The positivity rate is down from an alarming high of 20% down to about 11%. And the 3-day average of hospitalizations are down from 8,000 to about 5,500. So currently we are also meeting all of the metrics for improving. But as was just mentioned, we have the Super Bowl coming up, and depending on whether people heed the advice to stay home and not to gather, or whether they don't, will determine what's going to happen 2 weeks down the road. And we're hoping that the continued vaccinations will begin to bring this under better control.
Thank you, Dr. Bob. Janessa mentioned the new COVID variants that have already been spreading in California. Dr. Bob, what are the key priorities to help control the spread and put an end to the pandemic?
Well, I think the best way to think about that, well, two points. Number one is that the African and Brazil variants, although they are less effective, the vaccine is less effective against them. The vaccines are not completely ineffective. So it seems like the vaccine efficacy goes down to about somewhere between 60 and 80% or so, which from a vaccine effectiveness standpoint, that's still pretty good. When you consider that the annual influenza vaccines are usually only about 40 to 50% effective, and that those vaccine strategies are what keep us from influenza pandemics. So it's not like these new variants, at least the ones so far, are completely resistant to the vaccines. So the point is that if we very aggressively continue with our vaccine efforts and we reduce the number of people who are susceptible to the virus, then we can contain virus in smaller pockets of replication. I like to think about this sort of in the same way that we talk about HIV community viral load. So the same concept is kind of useful here. The more people that get vaccinated, the number of circulating viruses, variants, and the wild type alike are going to decrease. So the community viral load will go down, and that will constrain the virus's ability to develop and propagate more new variants. So at the same time that we're doing that, the vaccine manufacturers need to discover what is unique to these variants and will enable them to then make new vaccines that will be effective in these variants. Fortunately, with the mRNA vaccine technology, that may be a relatively easy task. And as Dr. Fauci was saying a couple of weeks ago, they may be able to ramp up efficacy studies without going through all of the entire robust vaccine approval process. So those are the two things that need to happen. We need to vaccinate everybody, or as close to everybody as possible, and the Big pharma needs to, get to work on developing vaccines for these variants.
Thank you, Dr. Bob. Both the San Francisco AIDS Foundation and the Los Angeles LGBT Center have had to quickly pivot during this public health crisis, right? Already in the public health crisis that is HIV and HCV, but had to pivot again around COVID-19. How has that affected services at SFAF, Janessa?
I was thinking back to kind of the beginning of things, which it's kind of crazy to think that we're a little bit over a month away from when shelter in place was called last year. I remember that day so clearly. It feels like forever ago and like yesterday. We in the Bay Area had a very kind of jarring start to the shelter in place. We were coming to work and midday finding out that this was going to happen. And even with all the uncertainty at that time, I was really amazed by how our clinical and harm reduction team just adjusted. We didn't even close services for one day. Really, the team has shown the exceptional commitment that they have to serving the community. We've certainly adjusted our services to meet the increasing needs of the communities that we serve. Our navigation team, for instance, has supported the large number of individuals who are living with HIV, who have lost their benefits because they've lost their jobs and other resources. The community is really known that they can reach out to the foundation to get support for resources, for insurance, and in other areas. But like what you said, we've been really addressing the HIV, Hep C, and STI epidemics for years. And we've really tried to keep a focus on that as well as COVID-19. So much of the public health resources and infrastructure have really been devoted towards COVID-19. And so at the foundation, we've really tried to continue to offer HIV and STI services as much as possible. We've been pretty much the primary provider in San Francisco and in other parts of the Bay Area. We're still routinely diagnosing or identifying new HIV cases and supporting individuals through the diagnosis process. And so really trying to still hold those needs of the community. I would say more recently, we're cautiously starting to discuss changes that we might be able to make as restrictions lift over time. We're definitely keeping an eye on the PrEP rate in the Bay Area. Although it's hard to get accurate numbers, there's clearly been a decline in San Francisco and the Bay Area. Some of that might be related to behavior change or decreased risk. But our concern is that as people start to leave shelter in place, they may not be thinking about their HIV prevention methods. We've already started to see some individuals reaching out or seeing, on apps that they've gotten their first dose of their vaccine and they feel like it's kind of safe to go ahead and resume pre-COVID patterns, but we're really trying to support the community and taking a harm reduction approach and really remembering and having a plan to protect against HIV and STIs.
Thank you, Janessa. Yes, I've seen folks on apps post their vaccination status. It's been interesting to see that. People are wanting to get back out and resume regular life. And what about the center, Dr. Bob? How has that affected, how has what we're going through affected services at the center?
When Janessa was saying that it seems like centuries ago and just yesterday, I'm reminded of the early days of the HIV, the early years of the HIV epidemic. I had the same sort of strange feeling of time passing. Everything seemed like we'd been in this disaster forever, but it was the passage of time just really becomes really distorted when every single day you're faced with some new nuance of the crisis that you're in the middle of. So I can really relate to that feeling. So what our services, how our services have changed is that we immediately began to shift to telehealth services for our primary care patients, our transgender patients, HIV, and even to a fair amount for our sexual health program, particularly the PrEP visits. We've learned an awful lot of things during this last year, and we've learned a lot of things that can be done with telephonic or video connections with our patients, and don't really require in-person visits. And the quality of care is not decremented at all. However, there are a significant number of things that really must be done or should be done in person. And those are the things that make us nervous right now. The sense that people are postponing and putting off routine visits or health maintenance visits, and we're having to manage multiple comorbidities, in a remote kind of a setting is disturbing. But we are doing the best we can, and our patients are very appreciative of our efforts to keep them safe, our staff safe, and the building safe. Having said that, now that we've gone through and are just finishing up on our second round of vaccinations for our healthcare staff, we're going to be starting to look at when we can begin to open up our in-person visits a little bit more, so that we'll be able to see more people face to face. But we have all of the same kinds of other issues that Janessa was mentioning, that we're trying to continue to provide services in this restrictive environment. And I think we're doing a good job of it. And but everybody's getting fatigued and really hoping for some kind of a return to normal status again. We just don't know exactly what that new normal is going to look like. It's unlikely that it will go back to completely normal anytime soon. But we are continuing to rise to the occasion and modify our activities depending on the realities.
One thing that both of you mentioned, and we didn't talk about this before in our prep leading up to this call, but both of you mentioned the teams that you both work with, and the dedication that they have shown to showing up to work and trying to minimize the interruption in services to folks that both of our organizations really provide life-saving and life-changing services. And I think a lot of folks who are watching and listening just want to know, like, how are your teams doing? We've been, as Janessa mentioned, we're coming on a year anniversary of the initial shelter-in-place order. How have the teams that you get to work alongside, how are they doing in this moment? Let's start with you, Janessa.
Sure. I've seen just amazing resilience in the team. I think, the majority of our clinical team are, LGBTQ and transient BIPOC identifying, and they see and know that their communities are particularly at risk. So being able to help support really has been a privilege that they've expressed, and really in a way helped us to kind of focus on the task at hand and not so much on kind of the crisis outside. This has happened along with other significant developments politically and socially that they've had to navigate. But yeah, that they have also actually had to support people with the weight of the emotion and the experience that they've had as well. So I've seen them, continue day after day coming in, being positive, really growing closer as a team, and taking pride on another level at the work that they're doing. Definitely, it's a challenging work to begin with, working in the fields that we do. But with this added layer, I'm just constantly amazed at what they've done, and really know that as an organization, we want to support them, and coming out of this process, allow time to recover from everything that they've had to deal with throughout this pandemic.
Thanks, Janessa. And what about the team at the center, Dr. Bob?
Yeah, I think that the DNA that runs through both of our organizations is strong, and it has a long history of responding in the midst of crisis. And so even the folks who are on our staff and our teams and are younger and don't remember, weren't alive even in the early days of the HIV epidemic, they've been working in our organization and have learned the passion that the rest of us have for caring for our community, no matter what adversities are thrown our way. So we are not strangers to forging on in the face of adversity. And I think that the amount of resilience that Janessa mentioned is remarkable. Everybody who works here has what I call a fire in their belly. They're here because they want to be here, because they know how important the work it is that we do, and they draw inspiration from each other. So how are they doing? Well, everybody's tired, they're weary, but the esprit de corps is strong. And when we pass each other in the hallway with our masks on, we give a little air fist bump and an elbow bump. And on the rare occasions that we actually see each other in person for more than a few fleeting moments, we become giddy. We become giddy because it's so wonderful to see somebody in person and not on a Zoom call, for example. But I think the enthusiasm and commitment is inspiring, and it continues to inspire me, and I'm continually humbled by the folks that I work with.
Well, thank you both for sharing that. And for those of you that are watching or listening, or maybe watching this a little bit later after it's been streamed live, this is why your support of TogetheRide is so important, that it supports the incredible work that the Los Angeles LGBT Center and San Francisco AIDS Foundation does and has continued to do in spite of the current COVID pandemic. So thank you to both of you and to your teams. I just wanted to take a moment to do that, to talk about that, because I think oftentimes we don't think about the real people that are doing this work every day. Well, a lot of folks not everyone is at home. Folks have to go in and because people, no matter if there's a pandemic or not, people still need the services that each of our agencies provides. So let's shift a little bit and we talked a little bit about this earlier around, and this is the topic for our conversation today, really, which is that the leading public health voices during the last year, Dr. Fauci, for instance, Dr. Birx, have a long history of working in HIV/AIDS and and many of them have talked about their experiences and how that has contributed to getting vaccines for COVID, and that body of work over the last many decades has really been able to, has really been the speed at which we've been able, that the scientific community has been able to develop the vaccines that we're now administering. Janessa, how has HIV/AIDS impacted the public health response to COVID-19?
Yeah, I can't imagine us being positioned the way we are now without the decades of HIV research and work that's gone on, 30 plus years. Really, that gave a jump start to responding to the COVID-19 pandemic. So much of the research on HIV vaccines, which as of yet hasn't really been successful, is what helped start the research into COVID-19 vaccines with the mRNA vaccines. Some of the early therapies that were tested in response to COVID-19 were medications or therapies that were developed in HIV research. So really from the technology and the research side, there was a strong foundation set for responding to COVID-19 from the decades of HIV research. On the response side, I had the privilege of observing locally in San Francisco with the Department of Public Health, just the quick shift to respond to COVID-19 and getting to work alongside individuals who are there from the start of the HIV/AIDS epidemic, really knowing, like Dr. Bob said, really knowing how to start and how to address this new virus that is different than HIV, but using a similar framework to start to address the COVID-19 pandemic. So it's been a privilege to get to observe and learn from the lessons of HIV and get to kind of forge and contribute to that development. I think on a community level, the work that's been done and advocacy around HIV has been immensely important with COVID-19 as well. Some of the people who have been at the forefront and leaders of advocating for the communities that experience disparities in HIV have really also taken on the fight to get the needed resources for those who are most at risk for COVID-19. So HIV really set a great foundation, all of that work over years for COVID-19, and really is essentially plotting the course to get out of the current situation with COVID-19.
Thanks, Janessa. Dr. Bob, you and I talked about how we're getting questions at our clinics and online that folks are asking, why hasn't this same effort yielded a vaccine for HIV?
Right. It's an excellent question. And the simplest answer is that HIV is a totally different virus from the coronavirus families. For one thing, it's a highly replication competent virus. It reproduces very, very, very quickly. And it's also error prone. In other words, it makes an awful lot of mutations, and it goes through its entire repertoire of possible mutations within a 24-hour period of unbridled replication. So there are several thousands of different viral variants that have been released into the public. And it's really difficult to develop a vaccine that is going to be effective against all of those different strains. That's point number one. Point number two is that the spike protein on the coronavirus turns out to be, I mean, it sits right on the surface of the virus. And it turns out that if you make an antibody to that particular spike protein, that can prevent the infection. So that sounds like a really great thing. Why don't we try that with HIV? Well, that was one of the very first vaccines that was developed, a vaccine against the GP120 component on the outside of the HIV virus. Turns out that it had no effect on decreasing infection. So it's a very tricky and sneaky virus, and it changes very rapidly, and the mechanisms for developing immunity are just not as effective for that as they are for some simpler viruses like the coronavirus. So that's, kind of in a nutshell why it's so difficult.
Thank you. Talking about vaccines, both the center and SFAF have vaccinated their frontline staffing, clinicians. How will each organization play a role, if any, in the vaccination rollout? Let's start in San Francisco.
We've seen pervasive disparities in COVID rates and deaths in Black and Latinx and Indigenous communities. And, despite good intentions with the vaccine rollout, there's a real potential for at least those disparities to remain, if not worsen. So at SFAF, we're really focusing our efforts on and resources on BIPOC communities, long-term survivor communities, as well as those experiencing homelessness. Right now, our program leaders are collaborating with community leaders on messaging and outreach. We're really hoping that we can answer the questions and provide reassurance right now for communities or individuals who may not be sure that they want the vaccine at this point. So hopefully once an individual is eligible to receive the vaccine, they will seek out the vaccine at that time. Our program leaders for Black, Latinx, and homeless groups are engaging with our staff to get feedback and really maximize the impact of our resources. We've had so many staff who really wanted to support the vaccine efforts. They either themselves or family members or those close to them have experienced the disparities of COVID-19, and this is really an opportunity for them to help or pay it forward with regards to the communities that they're a part of. It's really unfortunate that there are so many barriers, even for people who are eligible to receive the vaccine right now. We've prepared our clinic in the Castro and in the Tenderloin to be able to administer the vaccine. We've been able to do that on a small scale at this point for some of our elderly community members, and we're eagerly anticipating further vaccine shipments. It's really heartbreaking to see and hear our elderly community members, showing up at the clinic or calling, thinking that they heard that someone got a vaccine at our clinic and being desperate to get a vaccine. Everybody, but particularly our seniors deserve better. So we're really hoping that we're able to get more vaccine dosages locally and as an organization so we can support our priority communities.
Thank you, Janessa. And what about in LA, Dr. Bob?
Yeah, so, we have the same challenges here. And, we're a federally qualified healthcare center. And unfortunately, the whole vaccine distribution mechanism from the feds all the way down to the local clinics has unfortunately not really recognized the unique value and importance of federally qualified healthcare centers in distributing vaccine, because who is taking care of the population that are the most disenfranchised, the most adversely affected by social determinants of healthcare. It's the federally qualified healthcare centers. Who is it that administers most of the vaccines, to the population? It's the federally qualified healthcare centers. So the fact that the initial efforts in getting vaccinations down into the community have gone from the feds to the state to the local health departments, to hospitals and so forth, it misses, a really important resource. And we find ourselves begging to be let into the distribution. Right now we are receiving dribs and drabs of vaccine supplies, 100 at a time, 100 a week at a time, and we don't know, when the next supply is going to come. So we can't really make grand plans for extending our vaccination reach beyond our, limited population, the 65-year-old and older patient population, and really get as many vaccines into as many arms as possible. I think that we are the best poised, to reach into communities that have been disadvantaged, that are suspicious about the efficacy of vaccine, that are worried about discrimination, that don't want to show up at a vaccine place where nobody looks like them. We're frankly tired and frustrated about that, but we understand that everybody's trying the best they can, but we're just concerned that the unique position that we have in being able to get vaccines out efficiently is not being adequately recognized.
We are going to be coming up on some questions from our audience. So if you have questions, please write them in the chat on Twitch or at Facebook Live, and we'll get to them in just a second. Before we get there, both of you have talked about how important it is to have models of care that center LGBTQ health. Janessa, I know you're particularly passionate about that. Especially right now. Can you tell us, we've talked a little bit about that in our conversation so far, but can you talk a little bit more about that?
I could talk about that all day. And COVID just really has reinforced even more so that LGBTQ health-centered spaces really have to continue to exist. Being able to have a space where you feel safe, where you can be open, is just essential. Early on in shelter in place, there was a lot of messaging around, sexual health, like don't have sex, and that there was really a stigma that was developing. And we had clients coming in and even staff from the community saying, this is not an option for me. It's what can I do to protect myself in the community? And our staff developed really kind of a harm reduction approach to disseminate, which, we've learned over the decades that these absolute instructions like don't have sex do not work. So having guidance and being able to get the support that you need to develop a kind of a plan that works for you has been really important to a lot of our community members. One thing that I'm hearing about pretty often now is really a lack of prioritization of gender affirming care, clients who have lost their insurance or trying to get hormones, providers really not providing the response that the client deserves. I even had a client call last week because she was feeling really concerned about whether getting the vaccine would impact her hormone levels. And the provider that she first posed that question to had a perplexed look on her face that, why would this be an issue? And, it was clear that individual did not really prioritize what was important to the client. I think if that if the client was asking about insulin or something that that provider might have thought was essential, they may have responded differently. But we were able to provide, reassurance and the kind of information that that client needed in that moment. One thing that I've noticed, especially recently, is some of our long-term survivors coming in for services and really sharing their experience that the COVID-19 pandemic has really brought up a lot of the trauma, the loss, and the fear that they felt in the early AIDS epidemic, that they had kind of a similar anxiety level. And then the lack of uncertainty regarding getting the vaccine really resembled the struggles that they may have encountered early on to get access to antiretrovirals. So that those feelings that they have experienced, being able to come in and share them, scheduling vaccine appointments or receiving them, being a very emotional experience for these individuals. And it's a real privilege to be able to provide that to someone who is in a space where they feel comfortable sharing that. And it really being moving on, both sides that way. So I wish that we could share with the community just the amazing outpouring of gratitude and really having a community that knows that despite the uncertainty around, that they can reach out to us at the San Francisco AIDS Foundation to get the support they need, to get accurate information for individuals like themselves. And really the importance of that is just, growing.
Thank you, Janessa. Now I want to get to some questions from folks who are out there watching. And one of the questions is, it seems like, related to the vaccines, it seems like there's a lot of sketchy information about, and this comes from Twitch, information about the COVID vaccines out there. How can we vet information as legit? And how can we speak to friends and family who might be skeptical or misinformed? Who wants to take that one?
I can start. We have great resources with the CDC that are providing a lot of information. There's a lot of strong community-based organizations that are providing really tailored information for Black and Latinx communities. We need to produce more of that, but there are, like here locally in the Bay Area, there's the Getting to Zero and then East Bay Getting to Zero that have been posting an immense amount of information on everything you can imagine with COVID-19. So I'd encourage, especially East Bay Getting to Zero, is a great place to start in getting information.
Great, thanks, Janessa. Go ahead, Bob.
Oh, I was just going to say, I agree with all of that. I think that, a lot of people, when they are uncertain about the information that they're getting from general news sources, have questions about was the vaccine tested in among people who look like me, who are like me, who have risk factors like mine. And we really do have a lot of really detailed information about, the populations that comprised all of the study groups. And it's just a question of, making those, that data detail available to people in ways that, is easily understood. You don't have to talk down to people, but you can, you can make the language a lot more simple. But I think that, it's incumbent upon us, our organizations, to translate and parse that information, anticipate the questions, and begin to push out that information. There was a great quote that I got from another provider here. I want to get this right because it's really brilliant. He said yesterday, Um, he wants to vaccinate against fear with a dose of truth. And I really love that. I think that's what the role of our organizations are, is to develop these vaccines of truth that can vaccinate against fear. So.
Thank you for that. A question related to the vaccine too is, what do people living with HIV need to know about COVID-19 and the COVID vaccine?
Right. So we're continuing to learn, more about that. The first vaccine studies seem to show that there was really no worse outcome in terms of vaccine efficacy, as long as somebody's CD4 count was well above 200 and the viral loads were undetectable. That seems to be continuing to show true. But at the present time, I'm not aware of any particular concerns about people receiving the vaccine if they're HIV positive, in terms of worrying about greater side effects or lower efficacy. I think we can expect that folks who have, still really impaired or damaged immune systems might not develop as robust an immune response, but that doesn't mean that they should not still get the vaccine and get whatever protection they can.
Yeah, we've in San Francisco Department of Public Health been encouraging individuals living with HIV to get the vaccine. We'll definitely down the line have more information about the effectiveness, but certainly we have nothing to indicate concern about receiving it.
Right.
Another question we have from Twitch is, how many people do the center and the foundation serve every year? Let's start with the foundation, Janessa. How many folks does the foundation serve every year?
I need Jen Hecht.
I can help, Janessa.
Is it around? You can. Okay, you go for it.
So we throughout all of our sites, we have 3 physical sites. COVID is changed that a little bit, but the foundation serves 25,000 people a year through all of our different programs. And we're on a call. Janessa and I were on a call this morning with a colleague who was talking about kind of going over our first 2-quarter data around people coming in and those numbers starting to go up over the last couple of quarters after the initial shelter-in-place order. So, but the foundation serves about 25,000 people a year. What about the center, Dr. Bob?
Well, here's where I need Lori Jean, and unfortunately, she's not sitting on my shoulder because she has all of these figures right at her fingertips. So we have about 9,000 or 10,000 patients who are under continuity care with us. We have about another 30 to 35,000 folks who come and receive sexual health program services annually. And then we have a whole variety, just a lot more people that come in and receive other services, whether they're mental health, social services, substance use treatment services. So I don't really have that figure at my fingertips, but it's it's in the many, many, many thousands.
And certainly those numbers, the TogetheRide and AIDS Life Cycle teams can pull together and distribute to folks too. So we'll do an update at the next In Conversation, which is at the end of February. We'll have those numbers for you. Related to that, really, is we had two questions come in, actually the same question, one on Facebook, one on Twitch, around when folks donate to TogetheRide, how does that support this work? And I'll just say that our services are free, right? People come in, walk in or come through our doors, and the services that we provide at SFAF are free of charge, and that the donations that you make, the money that you're raising through TogetheRide, or the folks who are contributing to your effort, really make that possible, because the government contracts that we have don't pay for everything, and certainly, the way we're able to provide the care that we do, that Janessa talked about earlier, is because of supporters like you. So thank you for joining TogetheRide and for getting people to donate. One question that came in from Facebook is someone who's from out of state, not in California. How can I, as an out-of-state person, help in this mission? How do I do outreach, public education? What are the ways that I can contribute?
Well, I think, one of the things that I'm working on is ways in which our staff in health services can become ambassadors and opinion leaders and educate folks about the importance of COVID vaccination. So I would say, for right now, the mess that we're in right now is the COVID mess. There are other messes around that make that worse and also are important. But to get out of the COVID mess, we need to educate people about vaccines. So I think that somebody who really wants to do something important, become educated about vaccine details and reluctance among different populations for receiving the vaccine, and become an ambassador. That would be my suggestion.
I would just add, there are many areas that even in the United States, it still are not really, the community is not aware of PrEP or, having accurate information about HIV and STIs. So potentially seeing if there are local LGBTQ organizations or other organizations that you can support and be able to help disseminate some of the important information for especially young people to be able to learn how they can protect themselves, find HIV prevention strategies and STI testing.
Yeah, I'm glad you mentioned that, because I think one of the biggest anxieties that has arisen, that isn't related directly to COVID, but as a consequence to it, is what's happened with PrEP. Since 2012, we have learned that PrEP, when used properly and correctly, can almost 100% eliminate the risk of HIV infection. And for a variety of reasons, like Janessa was saying earlier, people are going off their PrEP because they either feel that they're not at risk for it, or it's just been inconvenient to keep it up to date. But that HIV infection is something that we can prevent. So when you find out that somebody has got an STI, that becomes a PrEP emergency. Somebody that gets an STI and they're not on PrEP, that's a PrEP emergency. That person needs to walk out the door today, if possible, with a prescription filled for PrEP, so that they don't become exposed and infected. So we really need a lot of ambassadors around STI prevention and PrEP.
Well, and the subliminal messages that you're giving Dr. Bob with your prep fan in the background, which I just love. If I ever come to your office, it might walk out with me.
Yeah, if I got the gay gene for snapping this thing, I would be able to show you, but I didn't get that gene. I didn't get the opera gene, and I didn't get that gene either. I don't know.
Well, next time I'm over at the LA Center, I'll come by and give you a few lessons of how to crack that fan, Dr. Bob.